next to the economy, healthcare is probably at the top of most people's list in terms of what they're concerned about. What would you say are kind of the key features of the healthcare reform movement that have been going on thus far that you really want people to focus on, that they might, kind of give short shrift to?
One of the things that I don't think has gotten any play is that the healthcare reform bill is a jobs bill. It's a big time jobs bill. First of all, the healthcare industry is one that has not had a problem in this recession. It has continued to grow. It has continued to hire. Here we are adding 30 to 36 million more people into the healthcare system. The number of jobs that is going to create on every level, we can't even begin to count at this point. We also have strong health professions development provisions in this bill. And within that, there are provisions and strong language that speak to supporting institutions that train underrepresented minorities and increasing minority participation in the entire workforce. Physicians, nursing, nurse educators, physician's assistants, nurse practitioners. So we have a great opportunity to increase the numbers of African American and other people of color in the health professions. We have community health worker bills. This is grants. This is one of the amendments that I worked on, which can give just someone who's in the community, who has a trust of the community, doesn't have to have any great educational skills, but have good people skills to be trained to do outreach on behalf of the healthcare system and be supportive of people who may need a little bit more support if they're ill, help to educate, help to make people aware of what's available. Those are available right now. We've increased community health centers, and we can expand on some existing community health centers, and we want to make sure that those community health centers go where they're needed, not where the most influential person in the House of the Senate is, but where they're needed. We started out this process as a Congressional Black Caucus and then joined by the Hispanic and the Asian Pacific American Caucus, knowing that insurance or lack of insurance only accounts for maybe 20% of the health disparities that we see in our community. So we knew we had to go beyond just insurance. So we've had the community health workers, the health profession, the community health centers. We actually have community transformation grants, which kind of track one of my pieces of legislation, which is called Health Empowerment Zones. But it's funding to communities to identify their health challenges and to develop plans with some help and technical assistance as to how to address, how to change the public health infrastructure or do whatever is needed to really support better health. So there's a lot of things in the bill, but right now, the provisions that are existing and available to everyone, a child with a pre-existing disease can no longer be denied health care coverage. Someone up to age 26 who may still be in school, not working, can continue to be on their parents' insurance. Preventive care services, so flu shots, mammograms, some of them still to be determined, but preventive care, no co-payments. They're available. We want to focus on prevention, and so the person going in for preventive care will not have to make a co-payment. There will be limits on how insurance companies cap your annual, they would generally cap at a limit how much they would pay for an individual in any given year. They're not going to be able to do that as much anymore. There's going to be limitations on how they can increase their premiums, and I know they're running fast to increase their premiums, but the Secretary is going to clamp down on some of that. So there are probably some other provisions that I'm not, well, here's one, the Medicare donut hole. Already rebates of $250 have gone out to anyone who finds himself in that donut hole until we can begin to close it. We begin to close it next year. Where prescription drugs that are brand name, when you get into that place in the prescription drug plan where you have to pay the full out-of-pocket for your medicines, every pharmaceutical company has agreed to cut their prices in half for anyone in the donut hole. And over the next 10 years, we're going to close that donut hole. So no, there will not be a time when you're on a prescription drug plan in Medicare that you will have to pay the total out-of-pocket costs. So there's so many things that are happening now, that are available now, that are really good about the bill. And anyone who thinks that they want to take it away from the people who are now going to begin enjoying these benefits, I think they're going to have a hard way to go.
Mm-hmm. You know, it sounds, from an outsider's perspective looking in, when you consider kind of the impact that some of these policies are going to have on low-income people, on minorities, people, on people who traditionally live in underserved areas, it seems like you and your colleagues with the Health Brain Trust probably had a significant impact on making sure that, you know, the interests of...
We did. And as I said, this is a time that the Tri-Caucus really came together and stuck to it. We had meetings we had many meetings with the Speaker. Mm-hmm. We had several meetings at the White House with the President, but we were not giving up on some. We decided very early on what our core principles were going to be in this bill, what we would insist would be there. Mm-hmm. And we never wavered. And so we did get a lot of provisions. I didn't even mention the fact that, and this is not starting now, but probably around 2014, states will be able to cover up to 133% of poverty, and they will be able to cover young, healthy adults who meet the poverty level. So it won't be any longer that parents are not covered, but their children are covered with Medicaid. They can also be covered with Medicaid. And then for those who are above the Medicaid income level, the exchange will allow them to go to a marketplace and pick the insurance that they feel best meets their needs. But if they're under 400% of poverty, they'll also get help paying their premiums. So I don't understand what the opposition to this bill is. I just don't understand.
It's a talking point,
Yeah.
right? It's something to rally
against.
It
is opposition to the Democratic and the Democratic president's agenda. Pure and simple. Pure and simple. They do not want us or him to succeed.
But it seems like, you know, just given the advances that have been made so far with actually passage of this bill, with, you know, despite, you know, still a downturn in the economy, we have progressed, right? It would seem that it's in everyone's best interest to support the Democratic leadership, even if you don't ideologically agree with
the agenda. Whether, you know, just look at the agenda. There's nothing in there that you shouldn't support. I know that people are still not feeling the effects of some of the policies. There's still too many people out of jobs. We see where poverty has increased. Mm-hmm. It started increasing under the Bush years. So it's just continuing to increase. But the economists say that the recession is over. That's all well and good. Now, that means that we've kind of started to fill in the hole that we found ourselves in. Mm-hmm. Now we got to go above that hole where people can really see the impact of and feel the impact of the policies. But it takes time to dig ourselves out from where we began when President Obama came into office. Mm-hmm. And it's hard to see the progress until it reaches your home and your family. Yeah. But we're on the right track, and independent observers who know economics can tell you that we're on the right track. Mm-hmm. So there's no reason to listen to some of the naysayers. Healthcare for everyone, there's nothing wrong with that. Jobs, keeping teachers in the classroom, keeping police and firemen working, extending unemployment benefits because we know how hard this recession has been on everyone. Those are the things that we've been working for, and we have passed almost single-handedly as Democrats without hardly any Republican support. So I hope that people understand that the road has not been easy, but that we have made steady progress, and if we keep on doing what we're doing, that they will be feeling and seeing the effects in their households.